is Scientist Hashim Bonza. I'm the chairman of the Association of Medical Laboratory Scientists of Nigeria, Kebbi State Branch.
My name is Kennedy Zebulon. I am the Hansen Chairman of the Association of Medical Laboratory Scientists Chairman, Kebbi State Ministry of Health Chapter.
My name is Mrs. Esther Christopher Uda. I am the treasurer of this great association, the branch treasurer of the association.
Today, we are commemorating the World Biomedical Laboratory Science Day.
Once a volunteer from the Muslim faith to give us an opening prayer. A volunteer from the Muslim faith to give us an opening prayer. Alhaji.
صلوا على النبي الكريم. الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين. إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين. اللهم صل على محمد وعلى آل محمد كما صليت ورحمت وباركت على إبراهيم وعلى آل إبراهيم في العالمين إنك حميد مجيد. Oh Allah, we are about to commence our program. Be our guide, lead us, put us on the right path, the path of those upon whom shown favor. Oh Allah, we don't have any other country than Nigeria. We don't want to be a food in any other place, neither in Niger or Benin Republicans. Give us a efficient security in this our country. Give us a security in our home, our places of worship, our places of work, market, and our route. Allah, as we commence, make us have a successful deliberation of this program. Subhana rabbika rabbil izzati amma yasifun wa salamun ala al-mursalin walhamdulillahi rabbil alamin.
Today, the Association of Medical Laboratory Scientists of Nigeria, in collaboration with Health System Consult Limited, are organizing a one-day symposium to commemorate the World Biomedical Laboratory Science Day.
The World Biomedical Laboratory Science Day was established to increase awareness on the role that medical laboratory scientists have been playing in providing quality healthcare service delivery.
It is a day to commemorate and also celebrate the medical laboratory scientists as a profession. Just as we heard from history, this whole day was established in 1996.
Healthcare provider provide the main workforce of medical laboratory practice in Federal Republic of Nigeria. We have about 3 arms of medical laboratory practitioners here in Nigeria. We have medical laboratory scientists, we have medical laboratory technicians, and we have medical laboratory assistants. It's just to remind us, these are the terminologies that you are well acquainted with, you know them all.
I know we are professionally trained in school, but it is true that in practice sometimes we get to forget some of these things. So this is a call to responsibility and reminding us that safety and quality is important and very vital part in patient management.
We have realized a great advancement in the area of research and clinical trials, courtesy of medical laboratory science as a profession.
Patient safety in their practice and organizational culture. This involves implementing robust safety protocols, training staff, and fostering a safety-conscious environment. Establish a national patient safety board, implement a national patient and staff reporting mechanism, leverage EHR and machine learning system, activate machine learning algorithm within electronic health records to detect risky conditions promptly. This system can alert staff to potential errors, drug interactions, or other safety concerns. And then we know the role of interdisciplinary collaboration cannot be emphasized, because when we look at between MLS, clinicians, and other health professionals, it is very, very critical for us to have that collaboration. It is a crucial practice in healthcare that involves approaching patient care from a team-based perspective. This collaborative approach brings together multiple health workers with varying professional background, including the medical lab scientists, clinicians. Here are some of the key points highlighting the significance. Why do we even need that collaboration? To enhance patients' outcome, to reduce medical errors. When different disciplines work together, they can provide a more comprehensive understanding of the patient's needs. It is only in Nigeria that you see us working separately. You go to other countries, you see that before, once the consultant or whatever finalize his own assessment of the patient, then he call for the whole team to sit and discuss and review the patient's issue. Then everybody will, every stakeholder must be involved. So this enables healthcare to address those needs more effectively, leading to improved patient outcome. Remember, the patient is our major focus. And then reduced medical errors. Research indicates that interdisciplinary cooperation is associated with increased patient safety. By combining diverse skill sets and perspective, interdisciplinary teams can reduce the occurrence of complications and medical errors.
So we are calling all our members in the states to come and attend this symposium. And in this symposium, the presentations we are making are presentations that has to do with improved quality of care.
With increasing cases of cancer, our paramedical laboratory scientist also is not left behind as preparation of tissues for processing, microtomy and staining is vital for correct diagnosis and prognosis to be established.
And this year make it 28 years by the grace of God. We normally come together every year to celebrate ourselves because we are a profession that is like a behind the scene profession. People don't know us much. But each time we celebrate, we create awareness, we tell people about ourselves, we tell people about what we do. We are like, when I say the engine of the hospital, because without accurate and right diagnosis, the doctor might be misled to think you are suffering from infection A or disease A, meanwhile it is disease B that is worrying you.
I would therefore like to make an audible call to every medical lab scientist in Kebbi State to continue to uphold the dignity of the profession in high esteem.
So such program is important. We keep having them recurrently because they help us to bring back to bear those things that we have been taught and ethically part of the profession that we have forgotten.
Our presentation covers the area of patient safety, and we also remind ourselves of the importance of implementation of quality management system in accordance with ISO 15189 standards. And if fully implemented, we believe our medical laboratories will be either 1-star, 2-star, or 3-star.
I want to reiterate our continued commitment in the fight against quackery of whatever kind, not only in the government-owned facilities, but also across all our private facilities.
So it is the duty and the function of the medical laboratory scientists to analyze different kinds of samples, to give direction and redirect the physician on the treatments to give to the sick patients.
So I hope we continue having such engagement where medical laboratory scientists will come together and be reminded the ethics of the profession and how to play the key role they need to play in patient management and safety.
And also, it's also a day to bring us together because in the profession we are of three cadres: the medical laboratory scientist, the medical laboratory technician, and the medical laboratory assistant. So a day like this brings us together, taking away that dichotomy or that division amongst us. So we are all medical laboratory science professions.
Even though it doesn't have this accreditation, but it is high time for us to look at ourselves and ensure that what we are doing conform with the set standards. So as part of the efforts made by the association, to ensure that all our members are up and doing.
I therefore want to use this opportunity to extend our wholehearted request to Kebbi State Government to facilitate the creation of the Department of Medical Laboratory Services at the State Ministry of Health.
I also want to thank the Chairman, Association of Medical Laboratory Sciences of Nigeria, Kebbi State Branch, and all the members for being a part of this program. Thank you. So, fine. HSCL is implementing a project called ACE3, Accelerating Control of the HIV Epidemic in Nigeria. The 3 there is because they have clusters. So the cluster 3 is Kebbi to Zamfara. That's why you see 3. So we are in cluster 3. Impact of HSCL in health service through the optimization of diagnosis and laboratory systems in Kebbi to Zamfara. These are just the highlights of what we are going to see as we move on. Thank you. Fine. Introduction. A street project covers 3 states. Just like I said before, Kebbi, Sokoto, and Zamfara is a consortium consisting of Health System Consult Limited, it's a consortium that consists of Health Consult, that's our HSCL. We are the prime, we are the lead in S3. Then we have another project called Project Hope, another project called Project Hope. They are into community engagement. Then the aim of this project is achieving accelerated HIV epidemic control through strategic intervention in a sustainable world approach. In Kebbi, the intervention is spread across 21 local governments within the government of Nigeria and private practice, the facilities and communities in Kebbi State. Fine. This is just a short statistics of what we have in Kebbi. We have 21 local government, we have comprehensive facilities. Those cooperative sites are those sites that have both testing, drugs, and monitoring. So we have 11. We have GH Arugungu, we have Sayana General Hospital, FMC, Jega General Hospital, GH Kamba, GH Kaoje, GH Koko, GH Yauri, GH Wara, Matapama General Hospital, and General Hospital Wasagu. I will not forget that one. So we have one CBO. The name of the CBO is Asupi. The name of the CBO is Asupi, and we have 12,471. We call it TS code. Those of treatment, current of treatment in Kebbi, from inception of the project down and the one that we are managing right now. So we have 12,471 currently on treatment. Thank you. Fine. If you look at our board, this is just the unique vision and target for 2030. So it's first, second, and third 95. So in the first 95, this is what we call entry point. Then second 95 is the treatment. Then third 95 is the monitoring.
So this event, I am excited that this is the first event that is organized under my leadership. This is the first celebration we had in the history of Kebbi State, of AMSIN Kebbi State branch. And I want to call on all our members to dedicate themselves to quality medical laboratory services. And I have an appeal to make to the government of today. As far as we are concerned, the medical laboratory scientists in Kebbi State doesn't have an established Department of Medical Laboratory Services in the State Ministry of Health. And this has led to many challenges we are currently facing as a professional body in Kebbi State, ranging from employment of qualified medical laboratory staffs, which are medical laboratory scientists, medical laboratory technicians, and medical laboratory assistants. Having these departments will go a long way to sustain all our efforts we are making and to ensure that we have a good standing at the level of the ministry, and we have a coordinating department for all medical laboratory services in Kebbi states. This department has been created in so many states. As we speak today, it is only in Sokoto and Kebbi that this department was not created at the level of the State Ministry of Health. Some has gone beyond the level of the State Ministry of Health. Some have already implemented and created this department at the level of Primary Healthcare Development Agency. We are making this call to governments to know the importance of the creation of these departments. Thank you very much.
Happy International